Bienvenue, welcome. My name is Dr. Jean Woodward, and I'm the Associate Dean for Student Services and Faculty Development at the College of Pharmacy at the University of New England. It's my great pleasure to welcome you to the College of Pharmacy White Coat ceremony for our professional student pharmacists in the class of 2023. It'll go quickly. White coat ceremonies have been used by schools of pharmacy and medicine as an outward sign of an inward and personal commitment to the profession. The white coat has had a long association with all things medical, scientific, and healing. It is also associated with attributes of purity and goodness. It has been a symbol of the trust that patients have had towards pharmacists that dates back to the apothecary days and continues to the present days of promoting wellness and providing pharmaceutical care, medication therapy management, and disease prevention. The profession of pharmacy is one that demands adherence to a set of ethical principles. These high ideals are necessary to ensure the high quality of care that society and our patients entrust us to provide. We must remember that it is a privilege to be involved in patient care and to practice pharmacy. And with that privilege comes many responsibilities. Now we will begin the ceremony. I ask that you please take a moment to silence your cell phones if you have not done so already, and I thank you for doing that. Now I want you to note that today's ceremony is being live streamed to all parts of the world, and it will be available to view after the ceremony. Will the platform party, faculty, students, please process to the auditorium. Lots of smiling faces. Please be seated, everyone. At this time, it gives me great pleasure to introduce our platform party. I ask that the audience kindly hold its applause until all members are introduced. I ask the platform party to please stand briefly when introduced. Dr. James Krebs, Assistant Dean for Experiential Education. Dr. Robert McCarthy, Dean and Professor of the College of Pharmacy. Dr. Joshua Hamilton, UNE Provost and Senior Vice President for Academic Affairs. Dr. Nicholas Popovich, our keynote speaker. Dr. George Allen, Chair, Department of Pharmacy Practice. Dr. Olgan Gavench, Chair, Department of Pharmaceutical Sciences. Dr. Leslie Oakes, Chair, Department of Social and Administrative Pharmacy. Dr. Wallace Marsh, Associate Dean for Academic Affairs. Dr. Emily Dornblaser, Assistant Dean, Interprofessional Education and Practice. And finally, Dr. Stephanie Nichols, Associate Professor and Advisor to the Class of 2023. I'd like to point out a special guest in the audience. It's pharmacist James Catton. If you could stand. Jim is the Director of Pharmacy and PGY2 Residency Director at Northern Light Eastern Maine Medical Center. He's also Chair of the College of Pharmacy Dean's Advisory Council. Now I ask if there are other alumni, friends of the college, that maybe other students who are in the audience, to please stand and be acknowledged. Welcome, and thank you for your attendance and support of our students. At this time, we have two volunteers who have offered to sing for us this evening. Takes a lot of guts, I know. We have Dr. Michaela Fiore, Assistant Clinical Professor, Department of Pharmacy Practice, and Ms. Elsie Morgan, Class of 2021. I asked them to come to the stage to sing America the Beautiful.
Can everybody hear me okay? Haven't tested this out yet. Oh, beautiful for spacious skies, for amber waves of grain, for purple mountains' majesties above the fruited plain. America, America, God shed his grace on thee, and crown thy good with brotherhood from sea to shining sea. Oh, beautiful for heroes proved in liberating strife, who more than self their country loved, and mercy more than life. America, America, may God thy gold refine, till all success be nobleness, and every gain divine. Oh, beautiful for patriot dream that sees beyond the years, thine alabaster cities gleam, undimmed by
Thank you so much. It's hard to come up here and sing. Pharmacy education is based upon a strong foundation in the biomedical and pharmaceutical sciences. The Department of Pharmaceutical Sciences helps our students develop this strong foundation through courses such as biochemistry and pharmacology. It's my pleasure to introduce the chair of the Department of Pharmaceutical Sciences, Dr. Olga Gavench, to tell you more about their department and their faculty and staff. Dr. Gavench.
Thank you, Dean Woodward. Welcome, everybody. It's my pleasure to be here representing the Department of Pharmaceutical Sciences. For those of you who are students, welcome. We're glad to have you here, and you're going to be seeing us a lot in this first year. The Department of Pharmaceutical Sciences, as far as what we contribute to your education, is the foundational sciences which you need to know in order to build upon so that you can go ahead and learn all those nice clinical skills which you'll use every day in your practice. I sort of used to go through all the list of different courses that we go through as part of the pharmaceutical sciences curriculum. Things are a little bit different now because we have this great integrated curriculum, and we were sitting with some prospects, some students applying to the College of Pharmacy just yesterday. And I have a lot of fun talking about a new curriculum now because instead of having separate courses in, for example, pharmacology, pathophysiology, and medicinal chemistry, we have this great integrated curriculum. So for all the friends and family and loved ones in the audience, for those of you who have gone through school in the past, things are a little bit different now. It's a lot different for me too because I have to teach in a way that I didn't learn. Back when I was learning, we had a certain course that showed up at you showed up at a certain time, you sit there, the course is over, then you probably go to a different room with a different professor, and then you get to sit through the next course. Instead, we've put all the courses kind of in a blender, but in a good way, and now all the different little pieces have it's less like a smoothie and more like a jigsaw puzzle where we've crafted these pieces so that they really fit nicely into each other. So the little pieces of pharmacology that dovetail naturally into therapeutic use actually properly dovetail in our curriculum now. And as such, you're going to hear from my colleagues, Dr. Leslie Oakes and Dr. George Allen. We talk a lot more to each other across departments, which has been a lot of fun for me. I'm talking to my clinical colleagues in a way that I really haven't in the past decade. And I think for the better, we have a really just nice kind of connection. I'm making sure to teach things in a way that sets it up so that when they get up on stage, the foundations are laid and that they don't have to cover any holes. And I'm also very careful that I don't teach or rather misteach something which is their particular area of expertise. So it's a really exciting time for me to be an educator. Again, I want to say a little something to all the friends, family, loved ones in the audience. It's a great curriculum. It was a hard curriculum in the past. It's still a hard curriculum. I would say maybe it's even harder now. So you may get calls from your students during times of trial. So please, I would say, whether or not you've gone through a health professions training, all you need to do is listen. We try to do that for them, but sometimes they like to just call home. So be there for them. Know that we're here for them too. We want them to succeed. It's our job to make them succeed, and we're very proud to have you here with us today. So welcome.
Thank you, Dr. Gavench. You'll be pleased to see in the end how pretty that puzzle picture is. It'll work out for you. Not only does contemporary pharmacy practice require a foundation in the biomedical and pharmaceutical sciences, but it also requires practitioners who are competent in the clinical sciences. It's my pleasure to introduce Dr. George Allen, Chair of the Department of Pharmacy Practice, to tell you a little bit about their department and their faculty. Dr. Allen?
Thank you, Dr. Woodward. Welcome, everyone. Before I talk about the Department of Pharmacy Practice, I want to first Welcome everyone in the audience. I want to welcome the members of the university community, Provost Hamilton, also Dr. Popovich for donating his time today. I also want to welcome the members of the family and friends of our students, and finally welcome to you the class of 2023. The Department of Pharmacy Practice is the largest department in the College of Pharmacy. It has more than 20 faculty and staff. We have faculty with a broad range of areas of expertise. Some examples would be cardiology, critical care, drug information, ambulatory care, infectious diseases, to name just a few. And they all teach within those areas, perform research within those areas, and perform service within those areas. Our faculty also includes a member of the faculty and staff who direct the continuing education program, which provides continuing education throughout the New England area. And you heard me on the days that you were interviewing talking about our 3 buckets of teaching and scholarship and service. And so in terms of teaching, the pharmacy practice faculty are involved in all 4 years of the curriculum, including didactic teaching, laboratory-based teaching, and then experiential clinical teaching as you are in your 4th year of the curriculum. So we teach in a wide variety of courses. You'll see us in plenty of places. We've already had some fun, I think, in IGL1, so it's been good to work with you in just the first few weeks that you've been here. In terms of research, we all perform cutting-edge research. Most of that research involves students, which I think is a strength of the college, so I encourage you, if you're interested in research, to reach out to faculty to partner. And then in terms of service, we of course provide service at the college level, the university level, the professional level. We also have faculty who advocate for the profession of pharmacy and try to improve what pharmacists can do. In terms of service, though, I think the Department of Pharmacy Practice, that word practice is the most important. And so most of our faculty are clinicians who are in community settings, institutional settings, and they are working with patients, they are working with providers, and they are trying to improve the health of people across the state of Maine, and they also are advocating for improving what pharmacists can do in the state of Maine, which I think is really important, and I commend them all for their clinical work, which is a distinctive feature of our department. So, and I also want to acknowledge the staff in the department, Carrie Snyder and Pauline Dombrowick, who are not here today, but if you've not learned so already, you will learn that they are indispensable to us and to you, so I encourage you to get to know them. So on behalf of the Department of Pharmacy Practice, I welcome you as you reach this milestone in your careers in pharmacy, and we all look forward to working with you, and welcome.
Thank you, Dr. Allen. The Department of Social and Administrative Pharmacy focuses on the social and administrative sciences, and it was formed about a year ago. This is a brand new department at the College of Pharmacy, and I always used to say, social administrative pharmacy, what is it? It's everything about the drug except the drug itself. Everybody else handles the drug and how it's used and taken. We deal with other types of aspects, the people and the healthcare system. I asked Dr. Leslie Oakes, Department Chair, to please come to the podium to tell us a bit more.
Hi everyone, my name is Leslie Oakes and I'm Chair for the Department of Social and Administrative Pharmacy, and so happy to be here with you today. Congratulations to the class of P1. This is such a big day for you, but it's also a really big day for us too, welcoming you to the program and to our community, and we couldn't be happier for you. And to friends and family, thank you so much for being here and supporting the P1 students as they embark on quite a academic journey, but also a professional journey, and transitioning into a practitioner in whatever setting that they choose to practice in. And nowadays, honestly, students have so many choices in terms of how they will care for patients and what that might look like in the future. So it's as Dean Woodward just said, social and administrative pharmacy is really an applied science, but it focuses on the people aspect of pharmacy and medication use. Our department's focus is to understand how factors like cost, drug use, patient and provider communication and behaviors, pharmacy practice, and the organization of patient care and healthcare systems influence the use of those medications and ultimately those patient outcomes that are so important today. In our discipline, it's really interesting because we integrate knowledge from a lot of different disciplines and concepts from economics, psychology, sociology, management sciences, education, epidemiology, law, and ethics. And the faculty in our department teach and conduct research in biostatistics, population health, health outcomes, patient and provider perceptions and behaviors, medication safety and healthcare quality, pharmacoeconomics and managed care, healthcare systems management, and healthcare law and ethics. So as you see, we will see the P1 students in their second and third year of the curriculum. However, Dr. Tu and I have had the great honor to already be with some of the P1 students in the integrated learning course 1. So again, thank you so much for being with us today, and we're so proud and happy for this day. Thank you.
Thank you, Dr. Oakes. Finally, in addition to the strong basic science, clinical science, and social science foundations in contemporary pharmacy education, our student pharmacists will spend 1/3 of their educational efforts in opportunities to improve their professional practice through a series of introductory and advanced pharmacy practice experiences. It's my pleasure to introduce Dr. James Krebs, Assistant Dean for Experiential Education, who will tell you about the activities of the department and introduce staff members. Dr. Krebs?
Greetings, welcome everyone. This is really exciting. I've been at UNE 11 years, and each year I'm like, this is so really fabulous to be here. I think the students look amazing tonight. They have to be professional every day, but they cleaned up a little bit even more tonight. They're a little more glamorous, a little more handsome. It's like, you guys look great tonight. Experiential Ed, as Dr. Woodward said, we're the Office of Experiential Education, and many of you might think, what is experiential education? And I like to say it's a new fancier word for internships or for clinical rotations. And what our goal is to take all this information that our students learn in the class and then actually pull it all together and have them practice it. Because I think we can all say that, we can read something and take an exam, but to actually do it day after day, it doesn't really stick. And that's really our role. And so how do we do it? I have a team of 4, including myself. It's a mighty team of 4. And I have Lynn, my dear colleague, and Allison and Natalie, and we are an amazing team that works really hard to make sure our students get the best experience they can. And how that looks like is we provide experiences every semester. So what our students will do is they will learn information in the classroom, and then we send them out into the community, whether it be hospitals or community pharmacies or ambulatory care clinics, where they can reinforce those skills. So in a more detailed manner, our students, from the very beginning of the semester, we take anywhere from 2 to 4 hours, and we go out to community pharmacies, we do work in a simulation lab to start reinforcing those skills in year 1. And then by the end of their first year, they will go out to a community pharmacy, and they will work for 4 weeks for 160 hours. They will work early in the summer, side by side, with colleagues, with our trusted partners throughout New England to complete those skills. And during this time, they're working on communication skills, they're working on hardcore counseling stuff, OTC recommendations, learning about insurance and billing. They come back their second year. Again, we have them do some work on campus in our simulation lab, out in the community pharmacy. But then at the end of their second year, they will go out to a hospital for 3 weeks for 120 hours. And most students are pretty nervous at that point because many of them have worked in a community pharmacy. Maybe it's just in their first year, but some of them have worked for 6 months or 6 years. We've had students that work 20 years. So when they have to go to a hospital pharmacy, they're quite nervous about it. But they go out, and I'm really pleased because some of them come back their third year and say they want to be a hospital pharmacist. And I'm like, because that was my path. So it's always trying to find new paths for students that often don't think of the institutional path. During their third year, we bring them back in the sim lab. We work a lot more direct with our standardized patients. We work with our medical students, our physician's assistants, nursing students, and do a lot of simulations together in this building just across the hallway. But the big part is in their final year. Every 6 weeks, they will go out and complete a new internship. They will be anywhere from a CVS or Walgreens or Hannaford. They could be at an independent like Bedard's or Wilson's Pharmacy. They will spend 6 weeks at a hospital. It could be something like Eastern Maine Medical Center or Maine Medical Center or Southern Maine, as well as our critical access hospitals that are throughout the coast in rural Maine. As well, our students will spend 6 weeks in an ambulatory care clinic where they will provide direct patient care with other healthcare providers, whether it be physicians, nurse practitioners, NPs, nursing, they work there. And then as well, the students get to choose many electives in their final year, and those vary anywhere from a long-term care setting to nuclear pharmacy. They could be with the FDA or the CDC. And things I'm passionate about is we have global education. So the students will spend time with me and my colleagues in Thailand or Spain or Ghana. So they have these incredible experiences. So our goal is when they finish at the end of 4 years, we say that they're practice ready. So they should be able to be pharmacists treating their patients independently. And I know they'll all get there. So me and my team and my colleagues look forward to working with all of you over the next few years. I know we've talked a lot about already in class, but we'll see you in early December in SimLab, and then we'll start thinking about the community pharmacy in May. But you'll do well. Thank you.
Thank you, Dr. Krebs. At this time, I ask all of our faculty and staff to please stand and face the class of 2023. Students, our faculty and staff are here to help you discover your talents and skills as independent learners and student pharmacists. They are a great resource for you. I encourage you to get to know these caring people during your time in our program. They are committed to helping you become the best that you can be. One of the most important activities you can do while in pharmacy school is for each semester to learn, get to know a new faculty member personally outside of the classroom. Would the audience please join me in a round of applause for members of our faculty and staff? Thank you. Please be seated. Dean Robert McCarthy was appointed the 4th Dean of the University of New England College of Pharmacy just last year. August 1st, I believe, was his anniversary date. Dean McCarthy, would you please come to the podium and offer a welcome from the college?
Everybody, I want to reiterate what Dr. Krebs said. You all look really great. You dressed up very professionally all day, but you look even better today. So, good evening. On behalf of the faculty, staff, and students of the University of New England College of Pharmacy, I'm delighted to welcome you to our annual White Coat Ceremony. Over these years, the White Coat Ceremony has become as much of a tradition in the College of Pharmacy as our annual commencement. This event symbolizes the formal entry of our first professional year students into the profession of pharmacy. The white coat our students are about to receive and the oath they will take are symbols to remind them of their commitment to the care of patients. We are very pleased to have Dr. Nichols Popovich, Professor Emeritus from the University of Illinois at Chicago College of Pharmacy, with us today as our keynote speaker. Dr. Popovich is one of the most highly regarded leaders in pharmacy education and recipient last summer of the Lifetime Achievement Award from the American Association of Colleges of Pharmacy. He's been a beloved mentor to several generations of pharmacy and graduate students who have learned from Nick a love of pharmacy and a commitment to the care of patients. Dr. Popovich and I are longtime friends and colleagues, so it's particularly meaningful to me that he has chosen to make his first trip to Maine in 51 years to be with us today. I'm not sure Maine was I think it was part of Massachusetts at the time. So, you will recall in class that I've already taught the P1, so that I described the term pharmaceutical care, not on your quiz. No, I'm just kidding. The mission of pharmacists to ensure patients receive the intended outcomes of their drug therapy. When Dr. Popovich was president of the American Association of Colleges of Pharmacy, he coined the term educational care, caring about our students the way we want them to care about their patients. It's a philosophy I have personally embraced in my career as a pharmacy educator and repeated often to others. Dr. Popovich has a keen understanding of what it means to be a healthcare professional, and I can think of no one better suited in the Pharmacy Academy to share with us the nature of professionalism and caring in pharmacy. We're very proud to have him join us for this important ceremony today. A white coat ceremony allows us to recall why we choose to become a pharmacist, the opportunity to care for others, to use our knowledge and skills to help cure disease, alleviate discomfort, minimize symptoms, and in general, improve the lives of our patients. At the University of New England, the Dean of the College of Pharmacy traditionally has had the opportunity to address each class but twice, at their transition ceremony, which marks the beginning of their advanced pharmacy practice experiences, and at commencement. The white coat provides a third opportunity to speak to the class and remind them of what we expect of them as UNE students and what their patients will expect of them as their pharmacist. Your faculty and professional staff will do our part to prepare you to be outstanding pharmacists. For your part, we ask three things. First, work hard. The pharmacy curriculum is a very challenging one and requires your full attention and effort. Second, be honest in all your activities and interactions. Third, care about yourselves, each other, your faculty, your school, and most importantly, your patients. On this important day in your professional lives, I want to remind the class of 2023 of our expectations for you. Hard work, honesty, and caring. It's what we expect of a University of New England student pharmacist and a graduate of our program, and I'm certain it's what we will see from you going forward. To the class of 2023 and your family and friends who are here with you today, please accept the heartfelt congratulations of all of us in the College of Pharmacy. Welcome to the family of healthcare professionals.
I thought you were introducing the keynote speaker there for a while.
Was that? Well, I got a little carried away.
We're very honored to have Dr. Popovich here. We're very excited, actually. It's now my pleasure to introduce Dr. Joshua Hamilton. Dr. Hamilton is UNE's Provost and Senior Vice President for the Academic Affairs. Provost Hamilton.
Thank you, and good evening, everybody, and welcome to the University of New England, and welcome and congratulations, class of 2023. This is a wonderful night, and this is a great ceremony. I wanted to welcome all of you to the university and just give you a little background for those of you who are new to our university family. Education transforms lives, and that's really been the mission of the university for its entire history. We're a very young university, but we have deep, deep roots. We started as St. Francis College, which actually started as St. Francis High School in Biddeford, Maine, and it was created to educate the children of French-Canadian immigrants who had traveled down from Canada to work in the mills of Biddeford and Saco. There was no other place for them to go to school. They were heavily discriminated against and were not allowed in the school systems. And so this was an opportunity for those children through education to advance their lives. St. Francis High School became St. Francis Junior College and then a full-blown four-year college. About 40 years ago, a group of physicians here in Maine started the College of Osteopathic Medicine, an independent medical school. And a few years after that, that College of Osteopathic Medicine joined with St. Francis to become what's now the University of New England. About 20 years after that, they joined with Westbrook College, which is where we are now. We're actually in the Armory building of the National Guard, or the former Armory building. But right over there, the quad there, is the quad of Westbrook College, which goes back to 1831, also a college of opportunity, principally for immigrants who were working here in the mills, and one of the first colleges in the United States to educate women back in the early 1800s. So this university, although as a university itself is fairly new, it has these deep roots and this strong commitment and mission for educating people and letting them use education to better their lives and go on to successful careers. We're very proud of the College of Pharmacy. It's one of our younger professional schools here, but is already nationally known and just an outstanding College of Pharmacy with a terrific faculty and professional staff and just amazing students. It joins two other professional schools, as I mentioned, the College of Osteopathic Medicine, which is the only medical school in Maine, College of Dental Medicine next door, which is the only dental school in Maine, the College of Arts and Sciences, Westbrook College of Health Professions, and our online college. Collectively, we're the largest private university in the state of Maine, and importantly, I think, among many accolades that we've received, we're the #1 school in Maine for getting a job for our graduates. 94% of our graduates are employed in their field or in a graduate program to advance their careers within 6 months of graduation. So we take our educational mission very seriously. We're very focused. One of the great things about being here in pharmacy or the other professions is highly interprofessional. The world that you will enter as health professionals is highly interprofessional and becoming more so every day. Pharmacists, like other practitioners, used to work alone. And now we work in teams, and you'll be heavily relied on as a health professional, an integral part of that team. And here at UNE, you'll have opportunities not only to receive the incredible training that the faculty here just described for you, but you'll also have the opportunity to work interprofessionally because we have all these other health professions here at UNE, and we have wonderful clinical partners around the state and the region where you can do your rotations and learn that practice. And so that's a really remarkable feature of the university that I hope and know you'll take advantage of. As the previous speaker said, the white coat ceremony is really special. Several health professions developed this ceremony to induct you into the profession. So in less than 4 years, 3 years and 8 months, you'll be marching across this stage and also the big stage for the grand commencement of the university to receive your PharmD. But that's not where your profession begins, and that's the purpose of the white coat. You become a professional through this ceremony today as you enter the profession of pharmacy. And as people mentioned, you all look very nice, you're all dressed up, you look very professional. But the white coat is both to symbolize that you've joined this profession, but also as a demonstration to you that you're part of that profession and to begin to develop that professionalism and to take both pride in this profession, but also recognize the seriousness of the work that you'll do and literally the lives that you'll have control over in your profession and with your coworkers. And so it's a wonderful ceremony, and but also the symbolism, I think, is really profound that you have entered this profession. So for those of you, I know many of you were undergrads here at UNE, welcome back. And for those of you who, as we say in Maine, are from away, welcome and congratulations.
Thank you, Provost Hamilton. It's definitely an honor to have you here this evening. Nicholas G. Popovich. I've known Dr. Popovich for over 40 years. He's Professor Emeritus at the University of Illinois Chicago College of Pharmacy. Formerly, Dr. Popovich was on the faculty at the Purdue University College of Pharmacy. In fact, there are several faculty and pharmacists here today who benefited from his teaching. He was there for 27 years, where I first met him when I was in my graduate program. Dr. Popovich earned his baccalaureate, master's, and doctor of philosophy degrees from UIC College of Pharmacy. He has many accomplishments, accolades, and honors, and the dean started, because we have so many, we had to start with the dean starting, and then I'm going to finish up here. I've classified them as awards, recognition for teacher and mentor, and then awards and honors received from the American Association of Colleges of Pharmacy, which is the institution, the organization that colleges of pharmacy and pharmacy faculty belong to. So while at Purdue University, Dr. Popovich was also honored to receive 5 Professor Robert Hine Teaching Awards within the School of Pharmacy. He was the recipient of 2 university-wide Amico Awards for teaching excellence and was inducted as a founding fellow in the Purdue Teaching Academy in 1997. In May of 2014 and 2019, he was the recipient of the UIC COP Golden Apple Award, which is presented by the graduating class. These are the classes of 2014 and 2019, respectively. So it just showed that he took his love for teaching with him when he came here from Purdue, came to UIC from Purdue. In March of 2007, Dr. Popovich was awarded the American Pharmacists Association Gloria Franke Leadership Mentor Award. So not only our colleges of pharmacy and colleges in general and students are recognizing him, but we have the profession of pharmacy, the American Pharmacists Association, recognizing him. Then finally, from the American Association of Colleges of Pharmacy, in 1991-1992, he served as the president and chairman of the board of directors of that organization. He has been honored to receive six Rufus Lyman Awards for outstanding research that appears in the Journal of the American Pharmaceutical Association. No, I'm sorry, the American Journal of Pharmaceutical Education. I'm getting carried away. In 1997, he received the AACP Distinguished Educator Award, and as the dean mentioned earlier, last year he was awarded the AACP inaugural AACP Lifetime Achievement Award. Dr. Popovich possesses a keen interest in the personal and professional career development of Doctor of Pharmacy students, clinical residents, and fellows, graduate students, and junior faculty. Nick and I go way back, 40 years ago when I was a teaching assistant in his laboratory. I remember making a very serious mistake in teaching the students. And obviously he was very surprised that I was telling the students how to do things the wrong way. And so made me feel very, very little, I'll say little, that I did such an act. And I went to him after and I apologized. And this gentleman said, you know, you learn from your mistakes, right? Didn't make me feel guilty about what had happened. Basically reassured me that it was a one-time issue and built my confidence to continue working with him in his laboratory. It's my great pleasure to ask our keynote speaker, Dr. Nicholas Popovich, to come to the podium.
Hello, everyone. Hello. Hi. Hello. Okay. Anybody with a pulse and a heartbeat out there? Good. It's so nice to be with you. Very nice. And for me, it's really a distinct honor to be here and to give the White Coat Ceremony presentation to the class of 23. It's beautiful. It's really very special for me because Bob, your dean, and Dean Woodward and Dean McCarthy are very special friends for me. For the class of 23, I'm hoping tonight that you're going to start your academic journey. That's what it's going to be. And so I'm going to offer a couple of points for you to ponder and to think about. And some of it's been said already, but I'd like to just go over that again with you. Probably you're not going to remember very much of my speech tonight. You won't remember the presentation. You probably remember more about how you did on the medicinal chemistry test this afternoon. So as I asked a couple of you before, hopefully whenever you take any kind of an examination, your beautiful faculty asks the right questions, you know, so you can do well on your examinations. But some of what I'm going to share tonight will stick with you, some of it won't. I'm reminded back to when I was in grammar school that in my 8th grade, I had a beloved nun. Her name was Sister Mary Bernadette, and she said, Papa, well, she actually called me Nicky. She said, Nicky, you know, throw some mud against the wall, some of it sticks and some of it falls. And what Sister Bernadette was trying to get across to me is anything that we use is going to stick. Anything that we're not going to use is going to fall, and that's for sure. And then also, the thing that I want to impress upon you, if I can, is learn for the sake of learning. For the sake of learning. Don't learn for grades, okay? You're going to find out that if you learn for the sake of learning, the grades are going to follow. The grades are going to follow. That's what's going to happen to you. I'm also reminded about the time when I had the pleasure to listen to Coach Lou Holtz, who at that time was the coach of Notre Dame. And in his great presentation, he said, whenever there's presentations, you only remember maybe about 10% of what was actually said. So I'm hoping that there's a couple of points that you'll remember. But I also remember to make it to the point. Okay, we've sat here already. When I was proctoring an exam at Purdue University in a large chemistry hall, if you can picture a chemistry hall, that's 700 seats. 700 seats, and it's so big it has an upper deck. That's how much it is. That's where we had to give our examinations. And I'm proctoring the exam, and I'm walking down the aisle, and there's some carving in one of the desks. And what do you do when there's carving on the desk? You read it, right? Say yes. Yes. You read it, and it actually said, if I had 1 hour to live, I'd like to live it in Chemistry 115, because if I did, it'd be the longest hour of my life. Okay? So hopefully these next few minutes are not going to be the longest hour of your life. Okay? While you may be thinking that your first responsibility in the program and in the curriculum is to learn everything, one of the things that I really would hope you and to impress upon you is to develop your skills while you're in the program. Now you are a pharmacy educator. You're a pharmacy educator, and I can assure you that you're going to be seen that way by your family. Because no sooner now you're in pharmacy school, and when you have Thanksgiving dinner and when you have Christmas dinner this year, the aunts and uncles are going to be coming to you with bags of medications. What is this for? What is that for? Can I take this with that? That type of thing. And of course you're going to say, well, I'm not there yet in the curriculum, but I'll get back to you. I'll get back to you. But you're a pharmacy educator, and I want you to keep that in mind, because you're going to learn how to communicate. And not only communicate in the oral word, but also in the written way. You're going to also do what's best for your patients, certainly. You're going to have to make decisions about what over-the-counter drug products are we going to have. What are best for the patients? Can they take it? Are you going to triage them to a doctor? What are you going to do? But the other thing that I would tell you is develop your interpersonal skills. Communicate with everybody. Communicate with everybody. And if you don't work in a pharmacy, if you work at McDonald's, that's good, because you're developing your communication skills. You're certainly developing problem solving if they get the wrong sandwich. So again, develop those skills, because they're going to be very valuable to you. Also, the other thing that I would say is probably in your class of about 40 or 45, just judging by the numbers and everything, 70% of you are rather introverted. You might be a little bit reluctant in communicating with other people, and some of you are extroverted. You're going to talk and talk and talk. But the introverted students, what I need you to do is develop your communication skills. Take the risk. Talk. You heard from your distinguished department heads here putting the puzzle together. They need you to talk. They need you to become engaged in the classroom. That's extremely important, because when you do that, you're going to develop your confidence. You develop confidence, which is so critical. And take the risk. So if you say something that isn't correct or anything like that, so what? That's how we learn, okay? James Michener, the famous author, said, back, character is what you do on the third and fourth try. So talk up. That's very important. Now, your faculty has also adopted student outcomes, things that they would like you to become at the end of your, when you graduate, okay? You're going to evolve into communication skills. You're going to evolve into collaboration, all of these types of things. Now, each course will have certain outcomes that you will achieve, but you will only achieve it if you try, okay? And other courses will fill in the gaps where those don't, okay? So actively involve yourself in the coursework, okay? You'll find it's very rewarding. And the other thing, communicate with one another, talk with one another, okay? Talk to your fellow student. Are you as lost as I am in this course? Okay, talk, talk. That's important. But remember, And the one thing I want to stress, it's not you versus the faculty. Not at all. It's not you versus the faculty. It is you and the faculty together. Okay, that's what it is. Okay, I can assure you that when you graduate in May of 2023, it's going to go very fast. Right now, you don't think it's going to go fast, but I can assure you it's going to go fast. So take advantage of that. That's very important. Now, the one thing that I can't talk to you tonight because we don't have time is your character. There are 49 different character traits that every one of us have, and it's very important to develop certain character traits like benevolence. What should a pharmacist have dealing with patients? Compassion, okay? Creativity, initiative, justice. You're going to treat all your patients alike, regardless of race, color, whatever it is. Justice. They all get the same they get the same care. And of course, patience, okay, and virtue. So these are just a few, but you'll develop these through the role modeling of these fine individuals right here, your faculty. It's just like Robert Fulghum, the author, wrote Family Man. And in one of the Family Man statements, it says, listen to your children. Oh, no, don't worry that your children never listen to you. They're always watching you, okay? So you're going to be watching your faculty, and they're going to be wonderful role models for you in that regard. So watch your faculty and ask questions. Very important. At this point, I'd like to talk a little bit about leadership. Leadership is very important for you to develop, and we say leadership is important for pharmacists and everything, but how do you start? Do you automatically become a leader? Not at all. You don't. I would encourage you to join a pharmacy organization, pharmacy student organization. Whatever you decide to join, because that's your opportunity to contribute. But really, don't be a carrier pigeon. Get involved. Get involved. And when you get involved and you do things in your first, your P1 and your P2 year, by the time you get to the P3 year, your fellow students are going to recognize your value and your leadership potential, and you're going to get those leadership positions. But that's what it's all about. We need leaders, okay? We need leaders. But first, you have to be a follower, so do the follower bit. The other thing here that I think is important is for you to build your confidence, okay? Now we're going to have a quiz. Okay, ready? Okay, ready? Okay, now I want the class of 2023 to tell me what kind of a pharmacist you'll be if you have this amount of knowledge and you have this amount of confidence. Well, I don't know what that means. Can you yell it out? An awful pharmacist, okay? Now how about if the knowledge is here and confidence is up here? Now you're a threat to society, okay? All right? So they got to be in balance. They have to be in balance. Your confidence and your knowledge has to be in balance, which is very important, okay, for every practitioner. And leadership is also making things happen, seeing what needs to be done and taking the initiative to do that, a very important character trait. And we start with individuals. You're individuals now, and by the end of your graduation, you're going to be working together. You're going to be collaborating. The other thing is put other people first. Put them first. And don't worry who gets the credit. Don't worry about who gets the credit. If you do it so well, I will assure you the credit is going to get back to you. A former CEO of, I can't remember, it was Rand McNally Company, said, there's no limit to what a man or a woman can do if they don't worry about who gets the credit. So don't worry about the credit. Just do it. Our goal here is patient outcomes. And so when you're working with physicians, you're working with nurses, you're working with dentists, don't worry who gets the credit. Patient outcome is the goal. That's the important thing. Leadership also is being moral. It's also being fair, responsible, resourceful, right some of the time, but acknowledging all those times you're not right, okay? And taking credit for the things that bomb, okay? That's okay, all right? The other thing that I want you to keep in mind is have a service-minded orientation. Service-minded orientation. You're using your knowledge and skills for the benefit of society, which is extremely important. So again, very important to do that. Pharmacy is a service profession, you're going to find out. So to many consumers, it might be mired if I asked you what is the stereotype of the pharmacist. right now in the media, I think you would say there's the pharmacist counting by fives to 100 with the tablets. But that's not what pharmacists do. It's just, it fills the media thing of action. That's what they want. They want action. But think about all the patient counseling, think about all the types of advice you're going to give physicians and nurses. That's what it all is about. But we also must be accountable for what we're going to do, okay? Now, can we change the world? No, we can't change the world, but each one of us can change the world around us. And that's what I'm hoping you will do, one patient at a time. That's what it is. So welcome opportunities to be of service. Welcome opportunities to be of service to others. Okay? At Purdue University, several of our students worked in caregiver companions, where they actually gave respite to Alzheimer's patients' caregivers. Okay? Others gave drug abuse talks. Anything that's service-minded, we're changing the image of pharmacy, which is extremely important. We heard before about the introductory pharmacy practice experiences and the advanced ones. Perfect opportunities. When you're in your P1 year and you're in the introductory pharmacy practice experience, you will develop an orientation towards patients. That's a goal, to do that. Now, couple that when you're a little later in the curriculum and now you have the drug knowledge, guess what now? Now it comes together for the betterment of the patient. All right? So take advantage of those particular situations. The other thing that I would say to you is seize opportunities for the benefit of the others. I'm a little bit redundant here. All right? Very important. One story that I like to share is Dr. Rachel Riemann. A long time ago, probably about 10 years ago, she wrote a book, My Grandfather's Blessings. And it's a beautiful book because it has little vignettes in it about how people are blessings in other people's lives. Now, consider Dr. Riemann. She is a medical student. She's a medical student in New York. She's at Bellevue Hospital, and they hand her a tray, and they say, take the blood of the men on the second floor. No instruction, no nothing, go take it, okay? She's there, she's poking the guys, it's painful for them, it's agonizing for her, all right? And then all of a sudden, one day, it's probably about 2 weeks, she's doing this, and the guys are cringing. She's doing this, and all of a sudden, she looks next to her, and here's this guy in Bellevue Blues, Larry. Okay, Larry comes next to me, and he says to her, hey, kid, give me your arm. Give me your arm. I'm going to show you how to put a tourniquet on. Okay, I'm going to show you how to put a tourniquet on, and I'm going to show you how to draw blood with that needle. Okay, and very important, you don't want the vein to roll. So what you have to do is you have to put the open side of the cannula up on top. Okay, so what Larry would do after that is every day he would go with her as she went around, and the neat part about it is he would give her encouragement. He'd say, nice going, kid. Nice going, you're doing a good job and everything. And everybody loved Larry because now they weren't in pain anymore, okay? So all of a sudden then, she goes on with her career, and 3 years later, she is in the emergency room at Bellevue again, okay? She's in the emergency room at Bellevue again, and here comes Larry dead on a cart. And she was so surprised because she thought that Larry had learned all of everything in the service as a medic. He learned it on the street, okay? But if we think about it, Larry was a blessing to Dr. Riemann. He was a blessing, he taught her, and guess what? She has taught tens of thousands of medical students, okay? So be a blessing in people's lives. I think that's so very important. Be a blessing to everything you're going to do, and they will remember you, okay? The last thing that I want to talk to, or let me just say one quote. Henry Adams said, teachers touch eternity. They never know when their inspiration ends. And I would argue that pharmacists touch eternity too, because we don't know what our influence will be on the patients we serve. So serve them well, Okay, and if you're not worried, if you wonder how you're doing, Christmas and Thanksgiving again, when all the cookies roll into the pharmacy, then you'll know for sure. But the last thing that I want to talk to you is about stress, Do you think you're going to encounter stress in the next 4 years? Yeah, please say yes. Definitely. Sure, by all means. But it's very important to be in balance in life, okay? You have to have something that you like to do, whether it's to read a book, to watch TV. Some students have told me, I like to sleep. Okay, that's fine, sleep. But do something, okay? Watch TV and eat popcorn, okay? Do something that you enjoy to doing. It's extremely important for you because if you can handle the stress in pharmacy school, you're going to be able to handle the stress once you're out in the real world. That's the important point here. So relax and just enjoy those times. And the other thing you're going to learn is time management, okay? If you can learn to relax your stress reasonably, then you're going to be real well out in the real world. Indeed, I mean, if you're worried how you're going to do it or if I can do it, I want you to believe in yourself. Always believe in yourself. Because if you couldn't do it, you wouldn't be here, okay? Your faculty believe you can do it. That's why you're in the entering class of 2023. If you couldn't do it, you wouldn't be here. So always believe in yourself. And in closing, what I want to do is I want to just share with you, again, my congratulations to you as I share my thought. Hopefully some of the points will resonate with you, and hopefully you remember some of them. And hopefully this hasn't been the longest few minutes of your life, okay? And remember, use your knowledge and skills for the benefit of your patients and those you will serve, for in the end, it is in giving that all of us receive. Thank you very much.
Thank you for sharing such thoughtful advice and words. We have a small token of appreciation for you for taking the time and making the effort to be with us on this special occasion. It's a Maine buoy bell.
Put it in my bathtub.
The buoy bell evokes the haunting yet comforting sound that Maine fishermen experience while working along our rugged coast.
Beautiful,
Yep.
beautiful.
We would be fortunate for you to think of us when you hear it chime.
Oh, I'll think
Thank
of
you so much.
Thank you.
Now I'm pleased to welcome the class advisor, Dr. Stephanie Nichols, to the stage, or she's here already, right?
I wrote you guys a speech too. Very exciting. So, all right, here we go. All things are poison, and nothing is without poison. The dosage alone makes it so a thing is not a poison. Paracelsus, the father of toxicology, taught us this in the 1500s, and this concept still holds true today. The dose makes the poison. As pharmacists, we have a critical role in our society to assure that medications are used safely and effectively, and that we aren't poisoning our patients. The public agrees. On the yearly Gallup poll assessing the most trusted professions, pharmacists consistently rank as the second or third most trusted profession and have done so since its inception in 2002. This poll specifically asked members of the public to rate the honesty and ethical standards of people in various fields. You might be wondering who is number one. Nursing has always claimed the number one spot, and pharmacists have been neck and neck with physicians since the poll's inception. I'd say we're in pretty good company. So we know that honesty and ethical standards are critical to being a pharmacist, and the public agrees. What else makes a pharmacist, and what does it mean to be professional? Well, Webster defines professionalism as the conduct, aims, or qualities that characterize or mark a profession. It is the type of behavior expected of a professional person. So what is this type of behavior for a pharmacist? Well, it includes many components. As a healthcare professional, a pharmacist must consider the welfare of humanity and work to relieve human suffering. As the medication therapy expert, a pharmacist must apply knowledge, experience, skills, and compassion to assure optimal medication therapy outcomes for each of his or her patients. As a lifelong learner, a pharmacist must keep current in the field and maintain professional competency. As an extremely trusted professional, a pharmacist must maintain high moral and ethical standards. As a community leader, a pharmacist must help the profession evolve and grow as new patient care opportunities arise and have the potential to improve the well-being of others. As an educator, a pharmacist must be ready and able to teach patients in a way that they understand how to best take their medications. Finally, as an important member of the interprofessional team, a pharmacist must be a team player and be ready and willing to help educate other professionals about the safest and most effective way to use pharmacotherapy. It sounds like a lot, and it is. It is. Pharmacists are extremely trusted professionals, and we have an awesome responsibility, using the truest sense of the word. It really is awesome. But please, don't worry. Professionalism will click for you. Maybe it has already. Maybe you are still on your way. I remember when I realized that being a pharmacist was more than just a job. It was a career and a way of life. I realized that I wasn't just learning things to take a test, but I was truly learning things to help improve the lives of others. And when I realized that, my whole world changed. I am ecstatic that each of you are joining us in this exciting adventure of becoming a pharmacist. So congratulations.
Thank you, Dr. Nichols. At this time, we begin the offering of white coats. Just a heads up to students and guests, we will have professional photographers taking pictures of each student while they're being coated and while shaking hands with Dean McCarthy. Be prepared to face the audience when receiving assistance donning your coat, and to look into the camera when your photograph is taken with the dean. Guests are welcome to come forward to take pictures. Please, we ask you to do so, but we also ask that you please return to your seat when your photograph is taken. The plan is that our dean's ambassadors will bring, I guess, each row up to the side here, and Dr. James Krebs will begin introducing you. When he does, proceed to the center of the stage where one of the department chairs will assist you in donning your coat. Dr. Allen, Oakes, and Gavinch will help you put on the coat. That's where picture one occurs. And I will assist you straightening your collars and coats if needed, so that when you take your picture with Dean McCarthy, you'll be all set. Dean McCarthy will then shake your hand and provide a copy of the Pledge of Professionalism. Be prepared to pose and look into the camera at that time. Shake hands with the provost and Dr. Popovich, and as you process across the stage, your class advisor, Dr. Nichols, will congratulate you at the bottom of the stairs here and hand you the official University of New England pin to wear on your white coat, proudly, of course. We ask that all family and friends please hold their applause until students have returned to their seats. Will the first row of student pharmacists please rise, and Dean's ambassadors, please lead them to the stage. Dr. Krebs, please introduce the students.
Absolutely. I can get them here, yeah, sorry, yeah.
Do we have a mic?
Julia Brooks, she's from Lyman, Maine, and she studied pre-pharmacy at USM. Kendall Millard is from Auburn, Maine, and she studied pre-pharmacy at UNE. Huang Liu is from Berwick, Maine. She studied pre-pharmacy at UNE. Nasara Mohammed is from Lewiston, Maine, and she studied pre-pharmacy at UNE. Sarah Jabot, she's from Raleigh, Massachusetts. She studied pre-pharmacy at UNE. Hunter Moku, he studied pre-pharmacy at the University of New England, and he's from Manchester, New Hampshire. Cameron Olson is from Merrimack, New Hampshire, and he studied pre-pharmacy at UNE. Brandon Rico is from Montville, Connecticut, and he studied pre-pharmacy at UNE. Stephen Flynn is from Salem, New Hampshire, and he studied pre-pharmacy at UNE. Skylar Page is from Scarborough, Maine, and he studied pre-pharmacy at UNE. Christian Oliver is from Tampa, Florida. He completed studies of psychology at the University of Florida and pre-pharmacy at UNE. Alexis Hinckley. Alexis is from Clifton, Maine, and she studied at the University of New England. Rebecca Gay. She's from Biddeford, Maine, and she studied pre-pharmacy at UNE. Molly Beam is from Weymouth, Massachusetts. She studied pre-pharmacy at UNE as well as had studies completed at Stonehill College. Abigail Botbleiler, she's from South Portland, Maine, and she studied pre-pharmacy at UNE. Pon Savansam Bath is from South Portland, Maine, and she studied pre-pharmacy at UNE. Allison Newcomb. Allison is from West Gardner, Maine, and she studied pre-pharmacy at UNE. Leocati Flavi Nufak is from Baltimore, Maryland. She has an associate's degree in arts and sciences from Baltimore City Community College. Ifeoma Ogbudu is from Boston, Massachusetts. She received a Bachelor of Science in Biology from the University of Massachusetts. Margaret Achiro Okan Johnson is from South Portland, Maine, but originally from South Sudan. She has received a Bachelor of Arts in Biochemistry and a minor in Mathematics from Westminster College. Judith DeHaty is from Westbrook, Maine. She completed pre-pharmacy studies at Husson, as well as she received a Bachelor of Arts in Accounting from the Success School and Junior College in Haiti. Olivia Shaw is from Saco, Maine. She received a Bachelor of Science in Medical Biology and Medical Sciences from UNE. Allison White is from Northfield, Vermont. She received a Bachelor's in Medical Biology from UNE. Shay Martell is from East Hartland, Connecticut. She studied pre-pharmacy at UNE. Taylor Norris is from Barrington, Rhode Island. She studied pre-pharmacy at UNE. Dylan Ambrose is from Eastham, Massachusetts. He studied pre-pharmacy at UNE. Joshua Schultz is from Berwick, Maine. He received a Bachelor of Science in Neuroscience from UNE. Victoria Mitchell is from Saco, Maine. She studied pre-pharmacy at UNE. Sydney Jackson is from Oxford, Maine. She studied pre-pharmacy at UNE. Shane Pelletier is from Sanford, Maine, and he studied pre-pharmacy at UNE. Caroline Bailey is from Monroe, New Hampshire, and she studied pre-pharmacy at UNE. Susan Dolan is from North Conway, New Hampshire. She received a Bachelor's of Science in Medical Biology from UNE. Shelby Lane is from Millinocket, Maine. She received a BS in Biology from St. Joseph's College in Maine. Kate Bedard is from Bowdoin, Maine. She has received Associates in Liberal Arts from Central Maine Community College. Cheyenne McGuire, she is from Gloucester, Rhode Island. She studied pre-pharmacy at UNE. Amber Arbor, she's from Gardner, Maine. She received an associate's degree in business administration and business management from the University of Maine. Mackenzie Buxick, he's from South Amboy, New Jersey, and he studied pre-pharmacy at UNE. Raven Renzo is from Bangor, Maine, and she studied pre-pharmacy at UNE. Nicole Ullman, she's from Campton, New Hampshire, and she studied pre-pharmacy at UNE. Noah Pierce is from Turner, Maine, and he studied pre-pharmacy at UNE. Nicholas Goodrich, he's from Winterport, Maine, and he studied pre-pharmacy at UNE. Yes. Riley Staples is from Hollis, Maine, and she studied pre-pharmacy at UNE.
finish.
I do?
Yeah.
Where do I go, Jane? Sorry, I haven't looked at it. Great.
Okay.
Please join me in congratulating the University of New England College of Pharmacy class of 2023.
You need to take a look. There are people standing all over the place. Okay. You can remain standing because you're going to be saying the pledge. So pull out your pledge. Dr. Stephanie Nichols, class advisor, will now lead the students in their pledge of professionalism. As healthcare professionals, pharmacists must hold themselves to a high standard. By reciting or developing a professional pledge, new students are able to see early on the importance that our profession places on ethics and values. Dr. Nichols?
Okay. You're already standing. That's great. That was step number one. All right. Please raise. The Pledge of Professionalism is printed in the program if the audience would like to follow along. Please raise your right hand and recite with me the Pledge of Professionalism. As a student of pharmacy, I believe there is need to build and reinforce a professional identity founded on integrity, ethical behavior, and honor. This development, a vital process in my education, will help ensure that I am true to the professional relationship I establish between myself and society as I become a member of the pharmacy community. Integrity will be an essential part of my everyday life, and I will pursue all academic and professional endeavors with honesty and commitment to service. To accomplish this goal of professional development, as a student of pharmacy, I will develop a sense of loyalty and duty to the profession by contributing to the well-being of others and by enthusiastically accepting the responsibility and accountability for membership in the profession. Foster professional competency through lifelong learning. I will strive for high ideals, teamwork, and unity within the profession in order to provide optimal patient care. Support my colleagues by actively encouraging personal commitment to the oath of the pharmacist and the code of ethics for pharmacists as set forth by the profession. Dedicate my life and service to practice to excellence. This will require an ongoing reassessment of personal and professional values. Maintain the highest ideals and professional attributes to ensure and facilitate the covenantal relationship required of the pharmaceutical caregiver. The profession of pharmacy is one that demands adherence to a set of ethical standards. These high ideals are necessary to ensure the quality of care extended to the patients I serve. As a student of pharmacy, I believe this does not start with graduation. Rather, it begins with my membership in this professional college. Therefore, I will strive to uphold these standards as I advance toward full membership in the profession of pharmacy. I voluntarily make this pledge of professionalism. Congratulations, class of 2023! I'm so proud of you guys.
Before entering their fourth year of clinical pharmacy practice in advanced pharmacy practice rotations, these students will again be asked to recite a similar professionalism pledge in a ceremony celebrating their transition from didactic courses to clinical practice. So this is it. In closing, those are the key words here, right? I first would like to ask the students to turn around and face all the people who have come here in support of them and clap to indicate that you're thanking them so much for what they're doing for you and their level of support. All right, you may be seated. I thank you as well. Thank all the parents, siblings, spouses, grandparents, cousins, all who have come to celebrate this wonderful occasion, and you'll be called upon, as was mentioned earlier, to help support these wonderful students progress through the program. I now ask each of the College of Pharmacy Dean's ambassadors, and we have P1s through P4s, to please stand and remain standing as I announce their names. I have Brianna Gower, Cassidy Coyne, Charlotte St. Louis, Emma Garceau, Jamie Dugan, Caitlin Gosling, Megan Ney, Melvin Rivera, Nicole St. Louis, and Sarah Manuels. These are our, they're already standing. These are our wonderful student ambassadors. They really give up their personal time and represent the college at this and other types of events like this, and they definitely play a vital role in all of our activities. This ceremony certainly would not have run smoothly today without them. Thank you. We have a professional staff that basically runs the college, who do all the planning, the administration, and the operationalization of this event. I ask you to please stand and remain standing as I announce your name. We have Ms. Renee Dana, Ms. Zainab Arslan, Ms. Allison Spies, they're all in the back, everyone. Ms. Marie Vrabel, and Ms. Margaret Donovan. Thank you so much. We definitely would not even have this event without your assistance. A special thank you goes to the Portland Brass and Dr. Michaela Fiore and Ms. Elsie Morgan for their musical performances. Photographers from Life Touch Photography and Jeff Schur Photography. Thank you. Mr. David Dadiego, who provides the video services, allowing us to live stream and record the ceremony. Students and guests, please feel free to stay for photos and to chat with faculty and staff. A photo backdrop is set up in this room, and I believe maybe in the reception area. Additionally, our photographer will take photos of students and families. The 2019 College of Pharmacy White Coat Ceremony has now concluded. I ask that you please remain seated until the platform party, faculty, staff, and students have exited. Good evening, bonsoir.